Before I detail the anatomy of the spinal cord itself, I want to go over this information briefly again because it was, I know a lot. So if you think about the cervical nerves, they each have different jobs, right? They're coming off of the spinal cord, and some of the neurons in each of these regions you can see are important in giving you your sense of touch and the stretch that you would feel, pain, temperature regulation, or temperature sensation, all of the sensations that you can receive from your limbs and your internal organs is going to be coming in these nerves. Also in these nerves are neurons that will go out and power up the muscles. So in the cervical region, all of the muscles that are powered up are somatic or skeletal muscles, and they are of the neck and the upper limb, so your arms basically. In the thoracic region, it is far more complicated because this is where you have not only sensory information, but you have motor output of skeletal muscles, all the muscles of the torso and abdomen, as well as sympathetic innervation of the smooth muscle, of blood vessels, of the GI tract, of the glands and the digestive organs, as well as the heart, the smooth muscle that surrounds the bronchioles. All of those things are coming off of these intercostal nerves. So you have sympathetic output as well as voluntary skeletal muscle output. Okay, the lumbar region is fairly straightforward again, just like the cervical region. There's sensory, of course, and then there's motor to skeletal muscles only. Then we get more complicated again in the sacral region. Of course, we have sensory input and motor once again. But now the motor is not just to the skeletal muscles of the lower limb, but also parasympathetic innervation of the bladder and reproductive organs. You might remember that the parasympathetic innervation is to help with resting and digesting, and reproduction is something that can only be attended to when you're not in a life or death situation. So that's the breakdown of the nerves. Now let's look at a close-up of the spinal cord itself. So I've drawn this to represent a thoracic region of the spinal cord, and I'm going to start with the spinal nerve. We can put that in pink. So that spinal nerve is going to contain both sensory and motor axons. Only in the thoracic region do we have this here, which is called the sympathetic chain ganglion, and there is one of these at every level for the intercostal nerves. And what occurs in here is a synapse or a connecting between two neurons that will then go and do the innervations that we talked about right here. Okay, so this sympathetic chain ganglia anatomically is only present coming off of T1 to L1 or 2. Okay, so if you have sensory and motor coming in here, well, they split right here. You can think of it like a freeway off-ramp. And this direction is sensory, so we'll do that in blue. I try to keep with that theme. Kind of comes in the back door of the spinal cord. Like that. So this part of the branch is called the dorsal root. And that's because it's on the back side of the spinal cord. And this swelling right here is another ganglion. A ganglion is just an area where cell bodies are located. Notice this was another ganglion here. And this is called the DRG, or the dorsal root ganglion. And this is the location of sensory cell bodies. Okay, then once, or the other split is actually, no, I'm going to keep going this way, sorry. Okay, so the sensory neurons come into the dorsal horn of the spinal cord. And you notice this looks a little like a butterfly. Well, this top part here is where all the sensory cell bodies are located that are going to go up to the brain. So the dorsal horn and it has sensory synapses. Okay, now the ventral horn, I'm just going to use a red pen and some hatch marks like this. We call this the ventral horn because it's on the front. And it contains motor cell bodies. What that means as far as this thoracic region is concerned is that some of these cell bodies are going to go out to power up skeletal muscles of the torso and maybe of the hips, and some of these motor neurons are going to go out and power up the sympathetic drive of your heart or your lungs or your GI tract or your kidneys or the reproductive organs. And then these neurons leave via the ventral roots All right, so imagine if there was a reflex that would cause you to quickly move your hand away from a hot stove. It would have to involve a sensory neuron coming in, I'll use blue, and it would have its cell body located here in this ganglion. But the action potential would keep traveling down the axon of this sensory nerve. And it would synapse with, now we'll switch to a green pen, with perhaps a connecting neuron here that would then synapse, now use a red pen, with a motor neuron that could go out to the skeletal muscle and cause the hand to move away. So that's the way reflexes work. You don't have to think about it. This doesn't have to go up to your brain. It just is happening at the level of the spinal cord. And their reflexes are almost always protective in nature. I'm going to put this right here. So reflexes, bypass, central processing, don't have to go up to the brain. And also, reflexes are protective in function. That's why and are extremely fast. Okay, but now let's think of all of the information that's going up and down the spinal cord. Well, all of this material around what looks like this butterfly is white matter. I think of it as the elevator, and the gray matter is like the different levels in an elevator. So we can use a purple, actually I take that back. Get your green pen. We're going to look at, so here's the pia mater. Look at the meninges. So there's the pia mater. And then surrounding that, do you remember what's next? Is the arachnoid mater, and I think I did that in orange on the brain picture, so we'll try to do that again. And remember that in the subarachnoid space, that's where we find the cerebral spinal fluid. We're using yellow again, just like we did on the brain. So this yellow is not to be confused with the dorsal horn that I also put in yellow. So a lumbar puncture is not done at in the thoracic region, but you can see that a lumbar puncture would be removing cerebral spinal fluid. So like this is the vertebrae, right? But there's space in between the vertebrae, so they can stick a needle in between the two vertebrae and do a lumbar puncture. And I think they usually do it at about L4 or L5 level for a lumbar puncture. Now, an epidural is different. Let's put the purple on here. This purple is the dura mater. You probably want me to label these, don't you? So purple is the dura mater, which means that unlike in the brain, there is a natural epidural space, usually filled with fat and maybe some blood vessels. That medication can be put in. Now, if when they're doing the epidural, so they put it right here, right? If the doctor pops through the dura mater, then, and the arachnoid mater is actually right up against it, which you can't tell from my picture, but if there's CSF that leaks out, then that can cause a really bad spinal headaches if you did something like this. If improper. epidural. So if it's an improper epidural and they push the needle in too far, they can pop a hole in the arachnoid motor, and a little bit of CSF can leak out, and then that can give a tremendous headache as the CSF is lowering from the brain. And what they often do to try to fix it is what's called a blood patch, where they put a piece of, they try to get the patient's own blood to clot over that spot.